How you doing, friends? This is Jay Perez. Okay, and what I'm doing now is it's called massage therapy, and you can do this every day. And these type of creams are the ones recommended: Remedy Clinical Moisturizing Cream, because what happens, it has nutrients, and it also reduces the itching. When the person itches and they scratch, and sometimes they scratch a lot and the skin is dry and it cracks, and what it creates is a wound. Usually chronic diabetes, diabetics get that, especially when they're swollen. Also, the best thing to do is turmeric in the diet. Turmeric. So basically, this type with the thumb, the bottom of the feet, make sure circulation, and you ask them if they feel this. You could pinch their toes, because that's the neuropathy. When that starts to happen, then they start feeling less and less sensations. So this with the thumb like that, and this you pinch the toes, and the ankles. The ankles are important; they don't get swollen. But basically, it's that her swollenness has gone down tremendously from the discharge time. Also up here, sneakers couldn't fit, and they call it the elephant feet. Usually diabetics get that, but this helps. And then you ask the person, do they feel this? You feel that? Since you feel it, okay. You feel that? That's just to make sure that that's the capillaries that are going into the blood has to flow into there. And past the ankles, you want that, especially in the ankle area. The ankle area is right there. You want that to happen. Because if it doesn't, and also turmeric in the diet, and they have the gummies, they have everything. This is Total Health, I think they sell it. They have the whole line, turmeric, ashwagandha. They have other stuff that are healthy, which is the idea. You want to create that, and little by little, you get rid of the sugars, the sodas, the type of sodas. You want to have, let's say, like ginger ale. If anything, ginger ale does not have caffeine. It does not have caffeine. So that's good. That's a plus. Now, what I did find out was that soda has phosphorus. Now, phosphorus is not good. And then caramel, water, and high fructose, corn syrup, all those things that the food have, so they can stay fresh, or drinks that have caffeine, and it's not good. They have these drinks now, and that they'll serve you, they'll give it to you. I don't know, it's just like a regular lemonade or whatever, but it's high on sugars, and it's a crazy number. Some people take it. Guess what? Start getting palpitations, and your pulse goes up, and you get different things. Arrhythmia, cardia. So you gotta be careful. You gotta watch your salt intake also. Some people do not have that problem. The idea is to do a blood test frequently. Sometimes if you have diabetes, you have blood pressure, or combinations of both, you should have blood work done every other week or every 2 weeks, but not every month or every 3 months. That's just for people who are in the green area, which is going to say, it's not going to say nothing because it's not abnormal. If it says abnormal, that means there's something, one of the ratings that are not good. Like potassium should be in a certain number, and basically that's what it is. All right, so this is called massage therapy. I mean, even if you don't have diabetes, this is what these places. And then there's certain types. You see the thumb doing that that increases the circulation, and it relaxes the person. My grandmother used to do this, and it was called in those days Santiguar, something like that, similar to that. That it was like they used to go like this and throw it out, throw it out, but you feel it. So supposedly I have her hands. That's what they tell me. That I have her hands. You gotta be patient for this too. Now it also makes it makes the person who's giving the massage sleepy too. That I noticed that, Santiguar, I think it's called. Some name coming from the Taino or the African language, one of the two. Santiguar has to be the Taino or Yoruba, West Africa. Well, anyway, so that's basically it. I will have to do this like this foot. So the other foot is. But they're about the same. Both of them were real super. I wish I would have had the pictures from before and after. And you see how much it works. This simple thing. And then there's other stuff you can take, but then there's chemicals. And also, what else? It's also going to give another problem. Side effects. Okay, take it away. Take it away, Johnny. Take it away.